Hi pregnant mums, this is Nisha from the 9 Month Club. So today I'm going to talk to you about the most important muscle when it comes to your labour, giving birth and getting a flat stomach after you've given birth. So that muscle, you know, most of you are probably thinking pelvic floor at this point, is not. It's the transverse abdominis. Now the transverse abdominis is one of the deepest muscles in our abdominal group. So it sits like a corset around your middle. The muscle attaches to the bottom ribs at the back, and it comes around like this, like my hands, and acts like a girdle. So when you contract it, it tightens up, pulls you in, and it also supports your posture, so it will make you sit taller and straighter. So there's 3 reasons why you really need to train this muscle during your pregnancy. Number 1, okay, so the last thing we want during our pregnancy is to lose our body shape. I know we're going to get a bump, and then, you know, bumps are beautiful. They can look really gorgeous and sexy as long as the rest of your body complements that. But your transverse abdominis is the thing that's going to keep that bump supported, and it's going to keep you looking toned and fit during your pregnancy, because it's all about having a really strong core. So your core is going to support your postural structures, and in particular it's going to support your spine. Now, as we all know, pregnancy back pain can be a really common aggravation during our 9 months. So it's something we really want to avoid, and by training our transverse abdominis, we can really support our spine and prevent things like pregnancy back pain and other things that might come from that, like mechanical hip pain in your joints. So secondly, it's going to give you an easy labour. Now, that's something that we are all looking forward to, and that's, I guess, why you're doing a pregnancy fitness program, or one of the reasons that it rates pretty highly in your pregnancy fitness program. None of us look forward to labour. We view it as this really traumatic experience. Actually, it's not. It can be really enjoyable, but you need to be fit for labour. So if your transverse abdominis is strong, it's going to make your labour so much easier, because this is the pushing muscle. I'll talk a little bit more about that in a minute. Lastly, once you've given birth to your baby, the transverse abdominis is the muscle that is going to give you a flat stomach pretty quickly after giving birth, and it's what's going to help you get back into your skinny jeans and look good like 10 days after birth, which is what happened for me, because I was really adamant that I wanted to train well during my pregnancy, and I wanted to get back into shape pretty quickly afterwards. So this is what you need to do, okay? Firstly, let's go back to the labour bit. When you come to labour, now, not too many midwives do this anymore, but in my experience, I had a midwife that told me when I was trying to push my baby out in 2nd stage of labour, she said, hold your breath and bear down. Now, this is a really bad thing to do in labour, and it's a really old-fashioned thing, and not a lot of midwives will advise you to do that anymore, but there are some that will still do it. The reason why, because if you hold your breath, you are cutting off your oxygen supply to your muscles, to your uterus, all those things that are working to help push your baby out. So if you cut off their oxygen supply, those muscles are not going to have adequate oxygen in order to contract fully in order to push your baby out. So that's number 1. Number 2, if you hold your breath, then you bear down, and it's what's called a Valsalva maneuver, and that's the technical term in fitness terms. What that means is that your blood pressure is going to shoot up really high. Now, in the 70s, when mothers were told to bear down and hold their breath, a lot of them would come out of the delivery room with bloodshot eyes, where all the blood vessels would burst because of the increased pressure that they created within their bodies. So it's a really bad thing to do. You don't want your blood pressure to shoot up suddenly, because as soon as it shoots up, then it drops really low afterwards. That's the second thing that happens. But anyway, it's not a good thing for you, and it's not a good thing for baby, and it's been proven it does not help when it comes to pushing your baby out in labour. So let's get into what the transverse abdominis is and how you can work it. So as I've said, it's your girdle, it's your corset. It supports your body, opens up your posture, it's going to lift your belly up, so keep it nice and toned and firm, and it's going to help you get a flat stomach after pregnancy. Okay, so how do we work it? This is what I'm going to show you today. So what I want you to do is you can either lie down on the floor or you can support yourself on your arms if you are too far along in your pregnancy and you don't find lying down on your back comfortable. So if you are more than 16 weeks, come here on your elbows, lift up out of your shoulders, so open the shoulder girdle and keep a nice long neck. Otherwise you can come down to the floor. And then I want you to have one hand on your belly above the navel, one hand on your belly below the navel. And all we're going to do is inhale. See how my belly rises as it fills up with air? Then when I exhale, I'm going to flatten that belly button down to my spine as much as I can. Now don't worry, this is not going to squash your baby. He or she might feel it if they're a little bit further along in your pregnancy, but it's not going to cause them any distress, okay? This is what is going to happen to them in labour, so it's better to get them used to the feeling now. Okay, so we hold that contraction for a count of 10, then we release with an inhale, and exhale again, flattening that belly button right down to the spine. Now as you do this, you want to open your pelvic floor, because if you're squeezing your baby out of labour, you don't want resistance here because it's going to make it hard. So as you bear down with your transverse abdominis, you release the pelvic floor to allow the baby to passage through and to pass out into the world. Okay, inhale and exhale. And pull that belly button flat down to the spine. So imagine it's just compressing down, creating as much of a flat stomach as you can. And that's it. Okay, so to make it harder, you can just progress the way that you use this exercise. So you begin on your back, then you can come to all fours. So here we go again. Inhale, exhale. And you'll find that's a little bit harder because now you're working against gravity to pull your belly button backwards. So that's it, simple exercise to work your transverse abdominis. Do those a few times a day, whenever you get 5 minutes. You don't have to get changed and do it, just do it in the office, wherever. And try and work yourself up to 3 to 5 sets of 20 squeezes per day. Okay, I'll see you soon. Bye.